Nothing makes me happier than taking a patient that I've already operated on before and helping them to achieve their goals in another area. This patient is just like that. We had done previous work in other areas of her body to improve her tummy and to improve her breasts. And then she came to me to change the shape of her face. She told me that her eyes felt tired and that people were telling her that she looked tired, and she felt like it was prematurely aging her face. I noted the heavy bags underneath, but also extra skin above. So in one surgery, I was able to deal with the eyelids below and above. We took the heavy fat from below and we actually repositioned that fat in a state-of-the-art approach to fill the hollows and balance the bags. This is called fat repositioning, pioneered by the experts in oculoplastic surgery. But I did the same thing in the upper eyelids. So not only did I remove skin, I also took the heaviness that was medial and rebalanced it lateral to provide an even fullness across the entire upper tarsal show. So this basically gave her a balanced upper lid. It highlighted her natural ethnic features, giving her her almond-shaped eyes. And I think she looks stunning. Not only is the skin better from doing what we did and removing the fat and removing skin, but also because of a light laser that we did at the same time. So we tightened skin, we moved fat, we removed skin, and we dealt with the deeper structures, basically giving a total refresh to her eyes. And you can see in the before and after, she's obviously happy. But I'm gonna go to the next level. We're doing skincare now to improve skin quality. We're following her long term, and eventually she'll be ready for the next step.